Hi, my name is Andres Espinosa, and my topic is percutaneous repair or medical treatment for secondary mitral regurgitation. Definition. Mitral regurgitation is the incompetence of the mitral valve that mobilizes flow from the left ventricle to the left atrium during ventricular systole. In patients who have chronic heart failure with reduced left ventricular ejection fraction, severe secondary mitral valve regurgitation is associated with a poor prognosis. Whether percutaneous mitral valve repair improve clinical outcomes in the patient population is unknown.
Regurgitation is poor. Although surgical mitral valve repair and replacement have not been shown to reduce hospitalizations or death, transcatheter mitral valve repair may improve clinical outcomes. In this multi-center randomized controlled open-label trial, 614 patients with heart failure and moderate to severe or severe secondary mitral regurgitation who remain symptomatic despite maximal medical therapy were randomized to transcatheter mitral valve repair plus medical therapy or to medical therapy alone. The primary efficacy endpoint was all hospitalizations for heart failure within 24 months. The primary safety endpoint was freedom from device-related complications at 12 months. A key pre-specified secondary endpoint was all-cause mortality within 24 months. The annualized rate of all hospitalizations for heart failure within 24 months was significantly lower in the device group than in the control group. At 12 months of follow-up, 96.6% of patients in the intervention group were free of device-related complications, exceeding a pre-specified threshold. All-cause mortality within 24 months was lower in the device group than in the control group. The authors conclude that among patients with heart failure and moderate to severe or severe secondary mitral regurgitation who remain symptomatic despite maximal medical therapy, transcatheter mitral valve repair may improve clinical outcomes. Full trial results are available at nejm.org.
Application in medicine. Percutaneous mitral valve repair is an option for patients with severe primary or secondary mitral regurgitation and heart failure refractory to medical therapy who cannot undergo surgery. Can improve symptoms and induce reverse remodeling. Also, the rate of residual and recurrent mitral regurgitation are higher than with a surgical repair. Pros and cons. Pros. Valve repair is the treatment of choice in severe degenerative mitral regurgitation and offers clear advantage, especially in patients with severe mitral regurgitation. Cons. Drugs such as beta blockers and ACE inhibitors can alleviate the symptoms of established heart failure, but should not be used to postpone the need for intervention. Use applied in Ecuador. According to statistics in Ecuador, cardiopathologies are the leading cause of death. In 2018, 7,862 deaths were registered for the reason, 360 more than 2017, when there were 7,496 according INEC data. Mariana Mancheno turned 74 2 months ago. She had open heart surgery in which the specialist changed and replaced 2 heart valves. They also play as Sam years ago. He suffered a heart attack and stroke. Conclusion. The treatment only with drugs or with surgical intervention will depend on the case of each patient. Despite the lack of data from randomized studies comparing the results of both replacement and repair, generally accept that whether feasible valve repair is the treatment of choice. Long-lasting valve repair is essential. The degenerative and mitral regurgitation caused by valves prolapse segmental can be repaired with low risk of recurrence of insufficiency and reoperation. Thank you.